Hey, everybody, and welcome to this episode of Healthy AF. This is kind of a special episode. I know it's been Movement May, and I have loved Movement May because, movement is one of my favorite things to talk about. And I had a entry into the healthcare system this month and wanted to share my experience. I think that it's a story that many of you can relate to, and I hope that it gives you some usefulness in your life. We're going to talk about today signs and symptoms of heart attack in women. I didn't have a heart attack, which is the good news, but that's the end. We'll start at the beginning. I had a fabulous trip to Mexico. I think I've mentioned it before, and you may have seen it on my social media. Had a fantastic vacation in Mexico, and when I got down there, I realized I was a little bit dizzy. Not bad, just a smidge. In fact, I thought it might be the remnants of like an inner ear fluid from a sinus infection that I had a little while before. And, I'd gotten on the plane, all the pressure changes. So I was pretty sure that it was just that. So I spent some time in Mexico, came home the next day. I traveled up to Hickory to see my mom and give a women's empowerment event that was a ton of fun. The whole time I'm just kind of dizzy. Not bad. I can push through, right? Nothing can stop me. I'm moving through. And I get home from mom's, and by this time, it's been almost 2 weeks. I'm still noticing it. Sometimes it's worse. Sometimes it's better. And finally, I'm saying to myself, I need to go get that checked out. I mean, surely there's something they can do about this ear. I've been kicking it down the road. And finally, I went to an early morning meeting, and it was really bad. Hard for me to concentrate. Felt like I was falling off the couch when in actuality, I wasn't moving at all. So I went to the urgent care. And lo and behold, the urgent care said, wow, your heart rate is 38. Let's send you to the emergency room. So I drove over to the emergency room, walked in and said, hi, I'm feeling dizzy and my heart rate is 38. And they said, we're going to bring you right back. And I said, all right. So now please remember that I have a nursing background, and the majority of my nursing practice was spent in cardiology, in the acute setting, and also in the cath lab. Okay. So I have a very deep cardiac nursing history here. They bring me back to the podcast. They bring me back to the emergency room, and I'm sitting on the stretcher, just like hanging out, just feeling the same way I felt for the last couple of weeks. And meanwhile, a flurry of activity. They grab a 12-lead EKG. They throw in a IV. They get my vital signs, of course. They pull blood. And they grab a chest x-ray. And the entire time I'm like, y'all, I'm good, man. I'm good. And then somewhere in me, that little nurse came up and said, hey, ding dong, you're a 51-year-old white female complaining of dizziness and a low heart rate. Of course they're doing this. They're treating this like a heart attack. And then I got to thinking, shit, what if I'm having a heart attack? And there were some tears, just a few, and it was scary. Yeah, it was really scary. I mean, when I looked at my family history and all the diagnostic tests that I'd had recently, I just turned 50. So I did all my diagnostic 50-year-old tests, right? Which included a calcium scan for my coronary arteries. So, and that was clean and shiny. My coronary arteries look great. But what if I were having a little bit of a heart attack? Did I really know the signs and symptoms? And I thought in my head, women present differently. And so I thought, well, okay, let's look at my symptoms. I'd been having this dizziness. I was a little bit more tired at the gym. I really couldn't concentrate very well. And there was that little bit of nausea in my tummy. Not enough to really get upset about, but just enough to make me feel a little uneasy sometimes. And I thought, holy shit. If I were your nurse, I would be saying, we need to check you out for MI. So I said to myself what I've said to so many patients. Yeah, I know you don't think you're having a heart attack. Might even be pretty unlikely. But here's the thing. Your heart can drop you. So you just need to have it checked. And so I stayed in the hospital. We did all the tests. I was not having a heart attack. My heart was a little wonky. And in fact, I've got this shiny new heart monitor. It's going to be my friend for the next 30 days just to check and make sure. The reason I'm doing a podcast on this is that I've spoken to several of my friends, particularly women friends, and we do this thing. We do this thing that's like, well, I don't think it's not that bad. I don't think it's anything serious. And then we hear things like, when you have a heart attack, your chest hurts. Well, it might. Your left arm has radiating pain. Well, it could. In women, it could just look like an overall feeling of like, something's not quite right. I just don't feel good. It could be my back hurts. It could be my throat just feels a little odd, right? It could be fatigue. It could be a little bit of nausea or a lot of nausea, feeling weak, getting sweaty, feeling hot. So here's my lesson for the week. Every time I feel icky, I'm not going to kick the can down the road. I'm going to take myself in and get checked whatever I need to get checked. Now, that doesn't mean that I want to go to the doctor, 24/7. But that does mean I need to do a little bit better job. Better job of listening to what the nurse Amy Chang would be telling the patient Amy Chang. Because she was clearly saying, girl, you need to take this seriously and get this checked. It's funny the thoughts that go through your head when you're sitting on the stretcher and everybody's treating you like you might fall out at any moment. And it also dawned on me like, hey, I've got 3 kids who are young adults and I want to be around for them. I don't want their story to be that of, mom didn't feel well for 2 weeks, but she ignored it. And then we lost our mom. I didn't want that to happen. So that was a really big pill for me to just get over my pride and get over my arrogance that I knew that this was fine, because it turned out that I wasn't having a heart attack, but also it wasn't fine. I do need to have my heart checked. And just because I'm healthy, I'll put air quotes around that, healthy and fit and exercise doesn't mean that when my body is telling me something, I can ignore it because nothing's wrong. And I can give myself some grace for poo-pooing it and for being in a pattern that I've been in a long time about taking care of myself and how quickly I need to take care of myself. And you can give yourself grace too. So I hope that gives you a little something to chew on. Make sure you get yourself checked out. And remember, signs of heart attack for women do not always look like the signs of heart attack we've heard about our whole lives for men. Know them. Get yourself to a hospital if you start having them, and expect them to give you the full service, 30 minutes or less, assessment for heart attack. Stay well, share, like, and subscribe this podcast. I appreciate you, and we'll see you next time.